Hello, my name's Dr. Gary Wright. I'm a consultant rheumatologist at the Belfast Trust. I'm also an honorary clinical lecturer at Queen's University in Belfast. I work privately at the Belfast Rheumatology Clinic, the only dedicated rheumatology private clinic in Northern Ireland. I also work at Kingsbridge Hospital private clinic. Why did I want to become a doctor? Well, this probably stems back to the fact that at school, early years of my grammar school education, I found that biology and chemistry were probably the two subjects that I was most interested in. This led to my interest in science and ultimately led to me pursuing a career in medicine. And this, combining my interest in biology and chemistry with my interest in people and interacting with people, inevitably led to the career choice of becoming a doctor. So why did I pick rheumatology as a specialty? Well, as a junior doctor training to be a physician, I was exposed to many different specialties. But when I came to rheumatology, I was particularly interested in the fact that it covered a wide variety of conditions, upwards of over 100 specific conditions. And not only that, the vast majority of the conditions are multi-system, i.e. it involves not just the joints, but also the cardiovascular system, the neurological system, and the respiratory system. So it was a general interest in being a physician that led me to the rheumatic diseases. The second thing about rheumatology is that in those days, I'm talking perhaps 30 years ago when I was a junior doctor, the treatment for the vast majority of rheumatic disorders was quite poor. And this has been revolutionised. Probably in the early stages of my career, I could see the change in treatment, and eventually we now have superb drugs to treat many of the rheumatic disorders, particularly the inflammatory arthritis diseases. The other thing about rheumatology is it crosses a wide range of conditions, from relatively minor self-limiting conditions such as tennis elbow, carpal tunnel, shoulder problems, to life-threatening multi-system disorders such as connective tissue disease and vasculitis. What I find most rewarding about my job is that currently we are able to do so much for patients with rheumatic disorders. The treatment has been revolutionised, as I have mentioned, over the last 20 years, and patients now with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis can look forward to treatments that have revolutionised the natural history of the condition. Not only that, we can actually make people feel better, which is such a rewarding thing for a physician.